पौष्टिकताको धमाका, मूल्यमा मिठास। मैले जस्तै तपाईहरूले पनि मनको उत्पादन प्रयोग गरेर हामीलाई यति धेरै माया दिनुभएकोमा हामी असाध्यै खुसी छौँ। हामीलाई गर्व छ स्वस्थ र शुद्ध उत्पादन तपाईहरूसम्म पुर्याउन सकेकोमा। हाम्रा उत्पादनका मुटुमा किसान, समुदाय र तपाईँ जस्तो साथ दिने मनहरू भएर नै हामी आज यो स्थानसम्म आइपुगेका छौँ। तपाईहरूको साथ, भरोसा र माया बिना मनको यात्रा सम्भव हुने थिएन। अब खुसी बाँड्ने पालो हाम्रो। अब पाउनुहोस् हाम्रा सम्पूर्ण डेरी उत्पादनहरू कम मूल्यमा, किनकि यहाँहरू गुणस्तरको मात्र होइन मायाको पनि हकदार हुनुहुन्छ। यही असार 15 गतेबाट हामी बाँड्दैछौँ मनको माया। मनको कुनै पनि प्रोडक्टहरूसँग फोटो खिचेर हामीलाई ट्याग गर्नुहोस् र मेरो तर्फबाट पाउनुहुनेछ मनको एक्साइटिङ गिफ्ट ह्याम्पर्स।
Doctor, let me stop you and ask you a question. Is it similar to an earthquake collapse? Is it similar to when an earthquake collapses a building?
Yes. Yes.
So is it the same kind of trauma?
The same kind of trauma.
Okay.
Because you are crushed.
Yes.
Under the...
So in 2015, we had earthquake as well.
Yes.
I know. And you were here in 2014, but in 2015, we had an earthquake.
Yes.
You were here for the avalanche.
I was in the avalanche in Annapurna.
So let me bring it all together. In the
Annapurna is another
story. So I'm just putting all of this together. I have limited time. So the earthquake that we had,
yes,
and then the bombing that you saw in Argentina and also in Beirut,
yes,
when the buildings collapse,
yes,
what kind of trauma do you see, and what should people do?
It's a sophisticated, excellent question. It's a sophisticated disease, meaning you are crushed.
Yeah.
And the idea is when you arrive to this guy's whatever, if you can put a needle and to pour fluids, IV fluids, it's wonderful. That's what you can see. Then to evacuate them, because they develop the crush, injury, damage to the muscles that affect the kidneys. And then later on, you need dialysis. And later on, you will need amputations. So it's another disease. What happened in the army, we had the experience, and I told the guys, that's what we have to do now. We need to do a fasciotomy, all this kind. I don't want to go in details. But there is and it's not nowadays that you can use a phone call and you put Google or you put ChatGPT, AI, and all this stuff, and you immediately receive the treatment. There was a paper in the New England Journal of Medicine that was written by Israelis in the north about crush injury. I called Israel. I'd asked them to send me by fax the paper, and I convinced the doctors. They were nice, very nice. And we worked according to the paper recommendation.
Dr. Avi, before I quickly move on towards Kenya and also Sri Lanka, right? I just want to ask, have you ever dealt with trauma related to earthquakes? Why I'm saying this, because we are, where we are geologically,
yes,
the belts that we have, we are prone to earthquakes.
We also.
Not like Japan, but we are definitely in a region.
Japan, it's okay. But the prediction is that Israel will have an earthquake.
Okay. So any suggestions that you have, first of all, for my listeners, and also to people who are listening all around the world, as well as to medical practitioners, any suggestions?
First of all, build good building.
Of course.
Again, Prevention.
Yes.
Again. It's again and again and again and again. We'll start with prevention. Once it happened, I told you, if you can approach the guys, if you see the hand like this, that's famous pictures, that the hand is like here, and that's the only one that you see. Put a needle, give fluids, only fluids, in order that the system will receive fluid, that the debris of the body, it's called rhabdomyolysis, meaning it's destruction of the muscle, and it's affected the kidneys.
Yeah.
So, it's a circle. So, in order to help, put fluid. First of all, put fluid. Later on, I don't know how long it will take to extract you. It's, then it depends on the weather. There are so many variables that you cannot give, a general recommendation. Then you have to do the diagnosis. By the way, when you put a tourniquet to stop the bleeding, you have the same effect.
Interesting.
If you are not releasing the tourniquet after 2 hours, you have rhabdomyolysis. Another thing, when you put a catheter, to these patients, the urine came like in the color of beer, not the black beer. And don't tell the patient, if somebody is asking you, don't tell the patient that it's because of stress.
Got it. Completely.
It's not stress. It's rhabdomyolysis.
Completely got it. I know, Doctor, you really have to rush, and I've got an update from the team as well. There was something that you mentioned to me about ambulances, but motorcycle ambulances.
Yes.
Could you please touch base on that, and how has it helped Israel and friends in Israel that we could go ahead and do that in Nepal?
Seeing what's happened here.
Yes.
From the day before yesterday, I'm speaking about these motorcycles, ambulances.
Yes.
Guys, we have experience in Israel. There is a voluntary unit called Ichud Hatzalah. I raise my hand. I am the medical director voluntarily. So they're excellent, of course.
Of course.
Of course. But they're doing excellent job on a motorcycle ambulance. They are in 2 minutes, they see the patient.
Search for motorcycle ambulance in Jerusalem?
In Jerusalem.
Yeah, search for motorcycle ambulance in Jerusalem, and then let's show that, and we'll quickly go ahead and wrap up as well.
Ichud Hatzalah. It's called Ichud Hatzalah.
Ichud Hatzalah. So search for this.
Search.
And we would love to show it on the TV as well. And is this the one, the first one?
Yes. No, that's another group. That's Magen David Adom. But it's on the same principle.
Same principle.
That's the principle.
So what does a person have in the box?
They have simple gadgets.
Like tourniquets.
Tourniquets, IV, for intubation. Depend on your level of expertise, of course, because the paramedic has more stuff than the volunteers. It's run by volunteers.
Okay.
The motorcycle is nearby. You are a professor, but you want to volunteer, and you know how to drive a motorcycle. It's nearby. You receive on the pager that something happened in street X, number 1. You are there in 2 minutes.
Beautiful.
And you are saving life. If I can get through this message to the people in Nepal
And around the world.
and around the world. Guys, it's a life-saving people and procedures. You know, if you are allergic now, what happens if you are now
Peanuts, let's say, or something.
peanuts, milk, something happened to you now?
I'd probably die, but I have you.
No, but I don't have EpiPen. I don't have adrenaline to give you.
Yeah, I know.
But if you have a nearby, if not a friend of you, nothing, stranger will come suddenly to you and will give you injection of adrenaline.
And I'll get time to live.
That's it.
Doctor, you really have to, I know you have another event. So one of the last things I want to ask you is, after doing this for more than 40 to 50 years.
Yes. 40, yes.
40 years. When
Okay.
when you reach 120 and you put down your scalpel and you take a break from everything, what do you want people to remember you by?
Lifesaver. Great believer in life. The greatest believer in life on earth.
Thank you so much for your time,
Thank you.
Doctor.
You're welcome.
I'll see you next in Jerusalem, and we'll have a chat more chat over coffee at your hospital.
You are welcome.
Thank you so much, sir.
You can meet me without hospital.
Of course. We'll travel together.
It's not Rivkind equivalent hospital.
Done. We'll
You can
catch
meet
up.
me on the soccer field with Betar Yerushalayim.
Done. And you bring your Pele shirt, and
Yes,
then we'll see
yes.
that. Thank you so much.